Hello, my name is Angela Nye. I'll be presenting an original peer-reviewed research article titled Evaluation of Picture Archiving and Communication System, Radiologist Perspective, published in 2023 in Informatics in Medicine Unlocked. This study explores how radiologists view PACS, not just its technical function, but its real impact on daily workflow, patient care, and hospital efficiency. My presentation will summarize the purpose, research methods, key findings, and the broader importance of this work for medical imaging administration. As someone working in radiology, I found it especially relevant because PACS affects nearly everything I do in imaging. Here are the objectives for my presentation. I'll start by identifying the main purpose of the study and the research gap the authors were trying to fill. Next, I'll describe how the study was conducted, who participated, how data was collected, and what kind of analysis was performed. Then I'll review the major findings, including both the strengths and weaknesses of PACS based on the radiologist's feedback. After that, I'll evaluate whether the author's conclusions were supported by their results. Finally, I'll discuss why this study matters in real-world imaging practice and what it means for radiology administration. According to the authors, the purpose of this research was to conduct a performance evaluation of PACS from the radiologist's perspective. That means instead of focusing on technical specifications or IT-based evaluations, they wanted to understand how the users, the radiologists, actually perceive PACS in their daily practice. In my own words, this study evaluated how well PACS was performing in the eyes of the people using it. It looked at how satisfied the radiologists were, what challenges they encountered, and how these systems influenced patient care and departmental efficiency. By asking radiologists directly, the authors aim to highlight both the success stories and problem areas within digital imaging workflows. From an administrative standpoint, this kind of evaluation is essential. Hospital leaders must continuously assess whether technology investments, like PACS, are meeting organizational goals for cost efficiency, productivity, and quality improvement. The research gap the authors identified was the lack of studies evaluating PACS from the perspective of the radiologists themselves. Most prior studies focused on system performance, things like storage speed, connectivity, or the reduction in film cost. However, few had examined user satisfaction, workflow integration, or challenges such as poor training or slow workstations. By addressing this gap, the authors contributed new information on how PACS systems are perceived in real hospital settings, especially in teaching hospitals where workflow and education are intertwined. They compared two different PACS vendors, labeled PACS A and PACS B, to see if there were differences in usability and patient care impact. This made the study not just descriptive but comparative, adding depth to the analysis. From an administrative perspective, this gap shows how often technology is implemented without proper user-based evaluation. Hospital management must bridge this gap by integrating research and feedback mechanisms into their technology planning processes. Now let's discuss the key findings. Overall, the results were very positive. About 90% of participants agreed that PACS met their expectations and improved care delivery. They believed PACS made imaging faster, more accessible, and more reliable. Radiologists reported being able to review and interpret images more efficiently, which in turn reduced patient waiting times and improved the overall quality of care. One interesting finding was that PACS also helped with education. Radiology residents found it easier to review cases and learn from stored images. However, the study also revealed ongoing challenges. The biggest issue was that the hospitals had not yet transitioned to a completely paperless workflow. Many processes still required printing reports or forms, which limited the PACS system's full potential. This detail underscores that implementing technology is only part of the process. True success depends on workflow integration and staff adaptation. Administratively, these results show that hospital management needs to monitor system performance and user satisfaction as part of a continuous quality improvement and ensure PACS transitions are properly supported. This study used a cross-sectional design, meaning it collected data at one specific point rather than following participants over a period of time. The sample included 138 radiologists and residents from two teaching hospitals in Isfahan, Iran. These hospitals use two different PACS systems, referred to as PACS A and PACS B. The researchers used a 40-item questionnaire divided into sections on demographics, PACS benefits, challenges, and impact on patient care. Responses were scored on a 3-point Likert scale: agree, no idea, or disagree. They then analyzed the data using statistical software. The questionnaires' validity and reliability were tested with a Cronbach's alpha of 0.71, which indicates good consistency. From an administrative angle, the researchers' structured data collection approach mirrors how hospital administrators should evaluate system performance in their own organizations. Like any study, this one had some limitations. First, it was limited to two hospitals, so the results couldn't possibly represent all PACS users in different healthcare systems or countries. The small sample size and geographic area restrict generalizability. Second, the study relied on self-reported data, which introduces the potential for bias. Radiologists may or may not have given answers they felt were expected, rather than fully objective responses. Finally, the study only included radiologists and residents. Technologists, nurses, or IT personnel were not surveyed, even though they interact with PACS daily. Including those perspectives in future research would provide a more complete understanding of how PACS influences the entire imaging workflow. These limitations also reveal an administrative opportunity. I believe that developing organization-wide data collection systems that include all PACS users would give hospital leaders a more complete view of performance. The authors' claims appear to be well supported by the data. Their conclusions directly reflect the findings, especially that PACS improves efficiency, patient care, and satisfaction, but still faces infrastructure-related challenges. They compared their results with previous literature cited within their own article, which also found that PACS enhances workflow but often suffers from technical and training barriers. The authors did not exaggerate or generalize beyond their data. They clearly linked their analysis back to measurable evidence. The authors were very transparent, and that helps establish the study's credibility. From an administrative lens, such transparency is critical. Leaders rely on evidence-based reporting when making decisions about technology investments, resource allocation, and staff training. This research is valuable for several reasons. First, it reinforces the idea that technology implementation is only successful when users are satisfied and trained to use it effectively. PACS may be a digital system, but it depends heavily on human interaction. Second, the study highlights how PACS can enhance not only efficiency and patient care, but also medical education. For teaching hospitals, this means students and residents gain faster, easier access to studies and imaging examples. Finally, this research provides guidance for administrators and IT leaders. It emphasizes the need for strong infrastructure, adequate workstations, and ongoing user support to achieve a truly paperless digital imaging environment. The implications go beyond Iran. They apply globally to hospitals that are updating their imaging departments. Administratively, this study demonstrates how PACS leadership plays a key role in aligning technology goals with departmental workflow. To conclude, PACS remains one of the most important technological advances in radiology. The study by Tadeon and colleagues demonstrates that when used effectively, PACS increases accessibility, improves report turnaround times, and enhances both patient and provider satisfaction. However, the authors also made it clear that several challenges remain. Infrastructure issues, limited workstation access, and the continued use of paper records still restrict the system's full potential. These challenges are not just technical, they're administrative. Hospitals must invest in digital infrastructure, IT support, and user training to sustain long term success. The authors recommend continued collaboration between administrators, radiologists, and system developers. They also encourage greater awareness of user feedback as a driver of system improvement. Looking ahead, future research should include radiologic technologists and IT professionals. They play crucial roles in daily PACS operations. The ultimate goal is to achieve a fully digital, paperless imaging environment that enhances patient outcomes, supports education, and promotes operational efficiency. Overall, this study reinforces that technological progress in healthcare only succeeds when it is supported by strong administrative leadership and a culture of continuous improvement.